was in AFib constantly since the time I was about 35.
I was playing tennis and pushed it too far and went into AFib.
He never looked like somebody who had heart problem.
I just felt bad. I couldn't put my finger on what it was, but it was an irregular heartbeat.
All of a sudden you become much more tired, lightheaded, and I would always just think, I'm going to try and push through it.
Not knowing day to day what was going to happen, I don't think he realized how fragile he was.
And having to think, now what am I going to do? I'm going to have surgery. I'm going to have something to fix this.
The electrical circuitry of the heart is fairly regular for everyone. AFib is just a series of short circuits that causes the muscle to all fire at the same time. So instead of a pumping, it fibrillates.
Medicines only work to a certain point, and of course every procedure that you have incurs with it a certain level of complication possibility.
In 1974, the first heart surgery in Northern California was performed at this site, and that legacy continues today with cutting-edge care. St. Helena Hospital has been a leader in cardiac services. If you have this condition or someone you care about does, you want them to have the best chance improving or curing this. We're the only place that assembles all the parts so that you can have the most comprehensive solution.
There's something about Napa Valley, and there's something about St. Helena, this hospital, that you have that community feel with really high-level service that you usually only see at a big university center. And so I saw all the pieces in place to be able to build a really incredible program.
For me, the clock was ticking. And I'd say for about 3 or 4 years, things were going pretty well. But I reverted back to AFib. That was just very, very discouraging. My cardiologist said, well, there's a new procedure that's known as a hybrid ablation procedure.
I was under the care of an electrophysiologist and was the one that started to share with me the different alternative procedure that could be done. I asked him at the time, I said, yeah, but do you have anybody who can do that? And he said, we have this Dr. Dunnington who is excellent at this, and it's his specialty. He was very natural. He spoke in layman's terms and explained things very well. I just had a feeling of confidence with him. It was exactly what I needed.
After meeting with Dr. Dunnington, I had all the confidence in the world that he was going to do what he said he was going to do.
The hybrid approach to AFib ablation basically is a hybrid of catheter ablation and surgical ablation. Basically, we do a small, minimally invasive operation with a thoracoscopic or port access. We follow that with a catheter procedure to give us our best chance at cure. It's really increased the patient's overall success rates up in that 80-90% range.
I just came out of there very happy and very confident that after all these years, something could be done.
The minute that surgery was over and I woke up, it was fixed.
I woke up and Laura just tell me you're in rhythm. It's been amazing for me, a life-changing deal.
Making a decision about a cardiac surgery procedure is really very major. When you meet Dr. Dunnington, you're immediately put at ease. He tells you that he can fix your problem, and you just understand the procedure and have confidence that this is the right decision.
We had made the right decision in going through with this procedure. Thank you, Dr. Dunnington. Thank you for giving me my husband back.
How are you living now? Is this a way that you feel like you want to live? Knowing that there's a procedure that you can have that can get you back to feeling how you were before this came about. There are options for you.
Many patients are anxious whenever they have to have anything done in the hospital. When our patients come to us here at St. Helena, They will be in the hands of an exceptionally well-trained team that has been assembled specifically so that we can have the best possible outcomes for our patients and for helping improve the quality of their life.
Patients are coming to us from all over the West Coast and even internationally for this innovative care. There are only a handful of sites in the world where this procedure is offered. So many patients have been told this is something you have to live with, but they're now finding out that there's hope and a cure, and St. Helena Hospital is offering that hope.